So now we are focusing our attention to the heart. So we start with the inspection. So we look for symmetry of the chest wall, deformities, other maybe scars after a bypass operation. Does the patient has a pacemaker? And we can also look for the apical pulse, where we will also talk a little bit later. After inspection, we continue with the palpation of the chest wall. And in some patients with a heart murmur, you can feel a so-called thrill. So place one hand on the thorax, and if the patient has a murmur, you can feel a thrill. You can also place the hand more on the vertical line and check if you can feel a thrill. The next step is to identify the apical pulse. The apical pulse is caused by a contraction of the left ventricle when it touches the chest wall. It is best to find the apical pulse first with three fingers. So we start at the apex, place 3 fingers here on this location, and then you feel the apical pulse. The next step is to appreciate if it is a strong, a prominent pulse, and what is the diameter of the pulse. Usually the diameter of the apical pulse is less than 2 centimeters. When the patient has an enlarged ventricle, the apical pulse is larger than 2 centimeters and it can be stronger. Sometimes it's quite difficult to identify the apical pulse, and then there are 2 tricks you can use. Ask the patient to move to the left side. Thank you. And now again you palpate the apex here, and now it becomes easier to identify the apical pulse. You can also ask the patient, take a deep breath in and out and hold. And after expiration, it's also easier to identify the apical pulse. The next step is percussion. With the percussion you can determine the size of the heart, but this examination is rarely done. Over the lungs you have a resonance sound, which becomes dull when you reach the heart. So you start with the percussion laterally. I will show it to you now. Resonant. And now more dull sound. So you can dull sound. Here's the heart. You can also do it from the right side. So this is one way, but as I said, it's quite rarely done. After the percussion, you start with the auscultation, and this is part of the next video.